So hello, my name's Adrian Richards, and today I'm going to be talking a little bit about variations of implant. We talked a bit about the difference between teardrop shaped and round implants before. Now I'm going to be talking a little bit about the actual variations in shapes within the round implants. So 20 years ago when I started doing breast implantation, there were really only 3 or 4 types of implants. Now there's over 250 sizes, different heights, different base widths, different shapes. So I'm going to talk a little bit about how you choose what's best for you. So if first of all just look at some round implants. Now you can see these implants are actually all of a very similar volume. Okay, they're 310 cc average volume, which is a fairly average volume of breast implant. This is a moderate projection implant. You can see it's much flatter than this one, which is a full height implant. Yeah, and this one, which is a extra height implant, and it's quite a different shape from the flatter one. Okay, now how do you choose which one's best for you? Well, the basic thing is it depends on your chest dimensions. So what we do is we measure the base of your breast with our caliper. Okay, so the base of your breast would typically be sort of 12 to 13 centimetres. We then minus your natural breast tissue, so that's using the pinch technique. So if your base is 13 centimetres, the pinch, which takes in 2 folds of skin, remember, so you can say that's from the inner and outer aspect, is 2 centimetres. So your base is 13, pinch is 2, that means you need an implant of 13 minus 2 centimetres in diameter, 11 centimetres. Okay, so we ascertain that, because what we don't want to do, we want to give you a good cleavage, but we don't want it to be too wide that you start getting unanatomical and anaesthetic if the breast implant sort of comes out too far laterally. Okay, so you need the right breast implant for you to give you the optimal result. So once we've ascertained the right base width, then we need to make a decision. Do you want a very natural appearance, in which case you'll go for a medium projection? Do you want a sort of more rounded appearance, in which case you go for a full projection? Or do you want more dramatic, which is the extra projection? So in my practice, I typically perform over 250 breast implants a year. The majority of people, probably 60 to 70%, would go for the full projection. Okay, people who want to be very subtle and want a very sort of gentle breast augmentation tend to go for the medium height, medium projection, and people who want more of a dramatic look go for the extra high. So again, just to summarise, the base width of the implant is governed by your chest diameters, and then we have a discussion about the projection you would prefer. And again, it's very similar with shaped implants. Remember, if they've got under 2 centimetres of pinch in the upper part of the breast, we tend to think shaped implants because we want to create the natural appearance of the breast. And again, you can either go for a low projection shaped implant, this is the top bit, flat here, shaped here, or you can go for a much higher projection, a much shorter height, higher projection. So again, it's really a very important, probably the most important thing about breast augmentation is number 1 to decide the plane under or over the muscle, and then to really spend a lot of time looking at the types of implants, shapes of implants, and even within the teardrop or round sort of families, the different projections and heights to really try and make sure that you get the best possible result. Thank you.